Morning assessors, my name is Camilo Gilabert. I'm the treating physiotherapy today to my patient Gina Smith. Gina Smith is a female 55 years old. She underwent a right total knee replacement that was uncomplicated on the 20th of September. That was 4 weeks ago. I don't have much information in this referral. I only had information that says that she was having some difficulty with sleeping since discharge, and they added for 1 week diazepam. I will be digging in with her. What was this about, and if there is an improvement, or maybe she will require further assistance with it. There is a limitation in the range of motion on the knee, so she's using 2 foot crutches for walking, and there is no brace. I don't have information on the weight bearing status. Usually after total knee replacement, the weight bearing is at tolerance, so I will be asking her about this indication. Social wise, she's a baker. So she needs to know this. Her supervisor needs to know when she can return to work and what are the duties that she can do in the meantime. So overall, because I don't have much information in this chart, I will be expecting a patient with mainly pain, weakness, and reduced range of motion that is using 2 foot crutches and is presenting to me with gait impairments and activity limitation due to this. So to further assess my patient, I would like to bring with me my stopwatch, make sure the 2 foot crutches are there, and my numeric rating pain scale, and my goniometer. All right, knock knock. Gonna wash my hands. Gina Smith.
Yeah,
Hi Gina, how are you?
I'm good. How are you?
Good, thank you. My name is Camilo Gilabert. I'm the treating physiotherapy today. How are you?
Nice to meet you.
Do you mind if I have a seat here?
No, go for it.
Thank you. Probably will be sitting here. Are you comfortable there?
Yeah, I'm good.
Okay, that's great. So Gina, as I told you, I'm the physio today. I want to know that I'm with the right patient. So do you mind telling me your full name, date of birth, and age, please?
I'm Gina Smith. I was born on the 12th of June in 1970, and
You are 55, are you?
Yeah.
Cool, thanks for sharing that. So Gina, as you can see, this is an exam situation for me. As a source exam, Y will be assessing me. Is that right for you?
the
That's
more the
right.
merrier.
Have you been in physio before, Gina?
Yes, I have.
Okay, so let
Many
me just
times.
many times for sure. So let me just do a quick brief of how my session is going to look like. The first part is going to be me asking you tons of questions to get to know you better. The second part will be hands-on assessment. We will be planning as well some goals together. And the third part will be some exercises. How does it sound to you?
Good.
Sounds good?
Mm.
That's great. Cool, Gina. So what brought you here? Let me just do a quick brief of what I have from your chart. I just got a referral. You had a total knee replacement on your right knee. That was 4 weeks ago. Is that correct?
Yep.
All right. So, would you mind telling me what led to the surgery? What happened? When did you have the surgery done?
Yeah, at my job I have to do a lot of standing and, quite physical. So, and it got really, really bad. I had really pain, like.
That
really
involves
huge.
that you mean in your job as a baker involves like a lot of standing time?
Yeah, a lot of standing, so
Alright.
that got really, really bad. I couldn't do it anymore,
Alright.
right? So,
All right.
and then it was really here, so on the inside of the leg, and then sometimes here. So, and then I went to the doctor, and the doctor sent me to physio, and I've been to physio, but that didn't do much.
Okay, so then you have to your knee down.
And so I've been back to the doctor, and he said that there's no good, and then he gave me a cortisone injection, right, to keep, he said that to keep the inflammation down, because it was, swollen and all that.
All right.
And warm. And that didn't do much either. So, and then he said, well, the
So-
only option we have is a knee replacement.
So for how long have you been living with this pain?
Oh, long time, right? So, yeah, I've been in this job for 30 years. 5 years, I think 5, yeah, quite a
And
lot
there is
of
any
years.
diagnosis like arthritis or arthrosis?
Nobody really told me any, but I think that's what it is, isn't it?
I don't know. I don't have much information on your chart, so
I don't know either. you know, but I think, you know, that's what the doctor mentioned before,
Okay.
you know, arthritis or something like that.
Was arthritis on your right knee?
Yeah.
Okay. And yeah, so you were basically not able to be standing the time was required for you?
Standing was bad, eh? And then,
Really bad.
you know, yeah,
For sure.
and then, you know, like walking stairs and, you know, and picking up things from the, you know, from the floor and all that, right?
Alright, so bending the knee, having to be
Yeah,
standing.
yeah. And, you know, when there's, you know, standing was that was, you know, as you can see, you know, proper.
You're a baker, no? And you have to be standing like how long do you need to stand there?
Yeah, basically, you know, that's what you do, you know, so you cannot
How
sit
long?
when you, how long? Well, I'm working 8-hour shifts, you know. I
So
would
you-
stand maybe 6, 7 hours, something
6
like
hours, and there is a break in between, but apart from the break, you have to be standing the whole time.
that. Yeah, it's standing, you know, and then bending a lot, you know, because
Okay. Alright, fair enough.
I do
So-
desserts.
How was your pain like very first thing in the morning?
When? Before?
Before, yeah.
Oh, yeah, mornings were really bad. I stiff and painful, you know,
Alright.
and once I get going a little bit, that was
Was
better.
it a bit better?
So you asking me between 1 and 10 or?
No, I was asking you, how was your pain? How would you describe your pain the first thing in the morning? It was really bad, and then as soon as it warms up, it was a bit better, but
Yeah.
obviously standing up
You know,
was really
stiffness, you know, you needed a little bit to, you know, to
Warm
get,
up.
to warm up and get going.
Alright.
Mm.
So now that you have bring up this about the numbers, you know, you are aware of the numbers, obviously. So let's put this rating scale that we have here, the numeric rating pain scale, from 0 to 10. To
Okay.
rate your pain. So 0 is not pain at all, and 10 is the worst pain that you could ever imagine. How would you rate your pain first thing in the morning before the surgery?
Before, yeah, I was a 7, you know, 6,
First thing in the
7,
morning.
yeah,
And when
yeah.
it warmed up,
Yeah, it was always there. You know, this is when I went to the doctors, you know, maybe it came down to a 3.
alright, and what about when you were standing, like during your job?
Yeah, and then, you know, after a while when standing, you know, it went up to, you know, 6, 7, you know,
Alright.
6, 7,
And
quite
what about
high.
when you were back home and having some rest?
That was good then it came back to, you know.
Alright.
So the standing is that was really, you know, that was bad. And
Alright.
because I, you know, with the pressure, you know, when I,
Yeah. And how was the what number would you say it was after your day job?
what number after?
Yeah, after your job, your routine.
At the end of the day?
Yeah, at the end of the day.
Yeah, it was 6, 7, you know,
Alright.
that's why I went to the doctor, so that I couldn't do it anymore.
Alright, so what sort of things were alleviating your pain?
Rest,
Resting.
you know, just
Anything
resting, you know, put my leg up a little bit, you know, get the weight off my leg, you know,
Alright.
so just,
Easy.
you know, little movements, you know,
For sure.
so something like that.
So then you had the knee done, and how is life after the surgery? How's life going?
Yeah.
How do you feel? What
I
are your
don't
thoughts?
know. Yeah, well, the physio said to me I should be a bit better,
Alright.
you know, so I still can't really, you know, move it as much,
Okay,
you know,
fair
I
enough.
can't
So let's
flex it, you know.
let's start from the beginning. How is the pain first thing in the morning now after the surgery?
Oh, it's much better, you
Much
know,
better
so
than
yeah, it's
before?
much better, you know, so
Alright.
it's a 4, you know, 3 to 4,
Alright.
something like that.
So are you able to bend your knee freely, or is it like really stiff for you now?
Yeah, I can only get to, you know, a certain point.
That's the further you
Yeah.
can go? Because of pain or because it feels stiff?
Stiff, and it's still like, how can I describe it, you know, so
Did
I
you
just,
feel like pressure?
pressure, yeah,
Okay.
it's still, you know.
Alright, so probably it's the inflammation still on, still there, probably, but I'm just guessing. But if you try to go and help your knee to bend, is it painful?
I can do it, yeah, it's just uncomfortable, like,
Feels uncomfortable.
uncomfortable, yeah, it's not like a 7, 8 or something like that, you know.
So
it's just,
what
you
number
know,
would you say your pain is now without moving when you are resting?
2.
True. And what about when you are moving your knee? How's the pain when you are moving your knee?
When I do this, yeah, Yeah, 3. You
And what
know.
about when you are standing on that leg? You have to
Yeah, it
keep
can
working.
get up. It's much better. You know, much better. Can get up to 4
All right.
max. You know, so.
Beautiful. So it came from 7 now to a 4, which
Yes.
is probably it's an amazing improvement,
Yeah.
and that's great.
Mm.
So yeah, now nowadays, what sort of things aggravates your pain?
Yeah, still the standing and the walking.
All right.
Still, you know, this is not up to scratch yet.
All right.
You
So
know?
how far can you walk, or how long can you walk?
Not far. Yeah, not much. I should
50
be
meters, 10 meters.
max. Yeah, a bit more than 20 meters, something
Right.
like
So
that. I think.
somehow somewhere between 20 and 30 meters.
Yeah.
All right. And that takes you how much? How long does it take for you to do that 20 meters?
Don't know. I never timed myself. Don't know.
Roughly?
Well,
Would you say 2 minutes? 1 minute?
oh, don't know. I don't know. To be
No
honest,
worries.
you know.
You still using your 2 forearm crutches?
Yep.
Somebody
Okay.
assessed and measured them for you properly?
Yes, somebody did, and I haven't
All
fiddled around with them.
All right. Do you feel they are comfortable for you?
I don't know. But we need to have a look at it. I don't know. I'm not sure.
We
You know,
can't
I
have-
haven't. You know, they were given to me like that, and then I didn't do anything.
No. I'm asking you if somebody assessed that for you there.
Yeah, the physio gave that to me in
All
the
right.
hospital.
So, and now I'm asking you, do you feel comfortable with them? Do you feel
Yeah, I still need them, eh?
You
Yeah.
still need
I still need them.
But you feel them comfortable? You feel safe walking with them?
Yeah.
Okay, easy. And yeah, so you are using that inside your house?
Yeah,
And
yeah,
outside?
yeah, and you know, outside for sure. You know, I use them outside.
What about inside your house?
Inside, yeah, if I can, you know, I mean, I don't have a big house, you know, I've got some, you know, so I can, things to hold on to.
So you're not using them inside your
I
house?
do, but not all the time.
So every now and then you don't use them
But
inside?
I don't feel unsafe, you know, if I don't use them. You know, I hold on to, you know, to things.
Alright. So, what about the weight bearing status? Did the surgeon tell you to do weight bearing as tolerated, full weight bearing? What is the recommendation from the surgeon?
He said I can put weight on, you
No
know,
problems at all?
you know. Yeah, I think, yeah, that's,
Alright.
yeah.
For
And
sure.
that's what the physio said as well, you know.
Beautiful.
So we
That's
started.
in line with what I was thinking, because I don't have information on your weight bearing status, but usually they do weight bearing as tolerated, which is great. So yeah, I'm happy with it. So now, what things are you doing now that alleviates your pain?
Right now,
Yeah.
yeah, resting still,
Anything
you know,
else?
and just yeah, little movements. The physio said, you know, yes, little movements. I have a pillow between my legs
Alright.
because at night, oh man, at night is really, you know, it hurts sometimes. I don't know what to do with that leg, you know.
Okay.
So I'm not sleeping very well actually.
You still having troubles for sleeping?
Yeah, I don't sleep. I've never been a good sleeper. You know, Baker, they get up early anyway.
Yeah.
You know, so, but, and then you worry, you know, worries, you know, I have worries, go back to work and can't retire yet.
Yeah, for
Yeah.
sure. You are having troubles because of the pain, are you?
Yeah, pain, worry, you know, worry. And then, you know,
Alright.
you feel pain more, you know, so it's not bad, but it's just, I don't sleep well.
Oh, right.
I don't think
Alright.
it's not pain.
What is it that is
Troubling me?
troubling you for sleeping?
Yeah, the whole thing, you know. So will I ever go back to work? You know, it's what am I going to do? You know, I'm the main.
I'm a bit
income.
worried about the outcome.
Yeah.
It's not the pain
you know.
anymore, so it's not the
No,
pain.
it's not the pain.
Okay.
It's not. It's more the
So
future.
what about Gina? Have you ever think about sharing these thoughts with somebody, like any health professional, health assist,
What?
a health professional?
Health. You
Yeah.
are one. Yeah, I'm sharing it with you.
All right, but any specialist, like any psychologist or somebody, have
Do
you
you
ever
think I
thought
need
about?
one? No.
I think that you need to think about if you are happy to share, or have you ever think about sharing this thought with somebody?
Unburden myself. Yeah, I've got my wife. You know. So.
Mhm. So, but are you okay with it? Because you are having troubles for sleeping, so.
Counseling. Yeah, yeah, okay. If it's, do I have to pay for it?
I can put you in contact. I'm not the specialist to tell you how much it's gonna cost, if it's on cover or those sort of stuff.
If it's for free, I do it.
All right, let's give it a crack then. Let's try and see how it goes. All right, Gina? And say with the pain, do you feel like you need assistance with your pain management at this stage?
Oh, yeah, sometimes, sometimes I wish I could throw a pill,
Are you taking any medications at the moment? And do you feel you need them for pain management?
Maybe, so it would be sometimes, yeah.
So what about together with this referral to counseling and maybe a psychologist, I can refer you back to your GP, so he can, or maybe the surgeon, right back to the surgeon, and he can come up with any pain medications for you.
Yeah, okay.
Sounds good?
Yeah, okay, yeah.
Yes.
That might be an idea. They didn't, you know what, they discharge you from hospital, they don't give you anything. I asked for,
For sure. Has to be really
give
frustrating.
me a pissy Panadol or something like that, right?
For sure. That's to be really, really frustrating.
Yeah.
Anyway, we can stay in touch with your health professionals, so maybe they can, give you something good for pain management.
Okay.
All
Good.
right.
Sounds good to me.
Yeah. So I think that I have a big picture of your little mobility status at the moment. I would like to know, where do you live? Is it a single-story house or double-story house?
A single story.
Single story. Do you have steps and ladders to get in and out of your
No,
house?
that's all good.
All right,
there's
so-
just one little, it's not even a step, it's just like a lip.
All right, just a little.
Yeah.
All right, cool. So you're managing well, no problems at all there.
Yeah, that's all good.
Cool. And you live with your wife, you told me? Is she working full-time?
I think she is, yeah.
All
Yeah,
right.
yeah, she is.
She is? All right. And is she supportive with you, helping you through the day?
Yes.
All right. So how do you get to the clinic today?
Taxi. I Ubered it.
You do Uber, and you have no problem with that, to get in and out of the Uber or stuff like that?
Yeah, I have to, it was a bit difficult, to,
Bend probably.
because I always sit in the back,
Yeah, for
So
sure.
because I had to bend that knee really,
And about
so-
walking into the clinic and
That's okay.
That's
yeah,
all right.
it's not
Easy.
too far.
sure. So what are your hobbies, Gina? What do you like to do in your free time?
Like gardening,
Gardening.
gardening, yeah.
All right.
So I'm usually, I bake during the day and then.
All right. That's all right. So, and Gina, what, you told me about your household, you live with your wife, she's supportive, I'm just taking the notes, to make my mental structure. If you don't mind me asking you, Gina, do you smoke?
Yes,
All right. And what about alcohol?
yes.
Have you ever think about, quitting or reducing the
Many
intake?
times.
Many times. And do you feel you want to give it a try now at this stage?
No.
Have anybody talked to you about the benefits of quitting smoking?
Many times.
Many times. So you're not into that anymore. You're not interested in quitting
I am when the time is right, on my terms.
on
you
your
know,
terms,
so
for
yeah,
sure.
yeah.
So be
I went
reassured.
somebody said, this spray, to try the spray, and then there's patches and.
All right. There is a lot
I'm
of
open to
benefits.
it.
There is a lot of benefits, Gina, of quitting smoking and drinking alcohol, especially in terms of how fast your body can heal if
Yeah.
you reduce the smoke and alcohol. So I just want to reassure and make sure you understand that there is a lot of resources available if you want to. All right. So if you want to, let me know and I can put you in
I
contact with
will.
them.
Thank you. I promise you.
That's all right. It's up to you. This is all. Everything is focused on your overall health and how fast you can heal. You get me? So,
Okay.
Yeah. In terms of your previous history, medical history, do you have any medical conditions that I
No.
should be aware of?
What? No, I've
Medical
never had
condition.
any.
Diagnosis.
No.
Any medications that you take? All right. Yeah. Let me ask you a few questions.
I had no, I don't have anything.
All right. And what about your left knee? Is your left knee all right? No problems at all?
It's alright. I had an I had a ruptured ACL actually when I was 17, eh?
Alright.
So maybe that's why.
Probably that led to the
so,
arthritis
yeah.
there. Alright.
Yeah.
So far the left knee is not troubling you?
No, always.
Easy. That's great. So Gina, just a few questions to rule out a few things that will require further assessment, alright? Yes or no question. Just answer yes or no, alright?
Yeah.
Have you ever experienced any headaches? Like any really bad headaches?
No.
That's, alright. Any problem with your vision or hearing or
No.
taste? Any problems articulating your words or swallowing or getting choked?
No.
Problems with your, like in your chest, like chest pain or cough?
No.
What about night sweats or fever or chills?
No.
Alright, problems with your bowel or bladder? Not
No.
at all. Any sudden weakness in any side of your body?
No.
Any sudden sensation impairment in any side of your body?
No.
Okay, great. So what are your expectations from today, Gina?
Yeah, I would like to walk a bit better, so
All right.
maybe that I'm, so that I get the physio was said range of motion, that I can move my leg a bit better. Yeah,
All
yeah,
right.
yeah.
So improve a little bit your range of motion
Mhm.
and work on your gait, quality. Is that something
Yeah,
that you
maybe,
want to
but
achieve
yeah,
today?
yeah, yeah.
Because
that might
that's
be-
something
might be
certainly
good.
that we can work on today,
Mm.
for sure. Anything else that you want to add for today's session?
No.
All right. All right. Good, Gina. I just missed one thing in regards to your job. I know you are a daycare. Are you in a long leave? What are your status now in terms of your job?
Yeah, I'm on leave, I'm
All
on
right.
leave without pay,
And are you
so
okay with it?
no.
All right. So what is the problem with that?
Money.
The money. Well,
Yeah,
that's one of the
sure.
problems.
We don't have a lot of,
So you find yourself struggling in terms economically. Is that the
Yeah,
the problem?
my wife is still working, but we still haven't, we still got a mortgage to pay,
All right. So what about?
2 cars.
I know it's not easy and it's going to be quite a few referrals, but this is not my scope of practice. I'm not qualified to advise you on in terms of money and that sort of stuff. So what about if I engage you with a social worker? He will be able to advise you on what options do you have in terms of money
Okay.
management and all those sort of stuff.
Okay. Yeah.
Make sense to you?
Yeah, okay.
All right. So I got just from your surgeon that you supervisor needs to know when you are going to be able to return
Back to work,
work.
yes, there's a bit
Yes,
of
and what
pressure
sort of
there.
duties are you able to do? Are you right?
That's
Are you
right.
All right. So in your job, is there any chance that you can do your activities like baking or hand stuff, but while you were sitting, or it has to be done while you are standing?
Well, if there's a few modifications, maybe I might be able to do that. I'm a dessert chef, so I've got a lot of, with these thingies,
Yeah.
You push and then you do this,
So what I'm thinking is maybe if you can find with your supervisor find activities that where you could be sitting could be easier for you to return early than later.
Yeah, I think this can be
But at
arranged.
this stage, probably it will be somehow between 8 to 12 weeks to start, getting back to your activities.
Okay.
All right.
I'm already 4 weeks off. Yeah, they said something to me like 3 months. It will take 3 months to go back to work or light
Something
duties.
like that. Light duties, for sure. So that's the general time frame. You know that everybody's different. Everybody feels different.
Yeah.
Especially if you quit smoking and quit alcohol, it's gonna be better for your rehab process.
Okay.
All right. So keep that in mind, Gina, as a motivation for those two areas.
Okay.
All right. So I think that I have everything here, Gina. So I would like to go on my hands-on assessment. All right. Is that okay for you? Just gonna quickly move this. All right. So no problems at all with your upper limbs. No problem with your vision,
no.
hearing. You can hear me and see me clearly.
Yeah.
All right. So is your right leg the operator leg? Is it? Cool. And you got your forearm crutches here. All right. So, can you please lift up the leg for me? Up, up, up. Good job. Down. Extend your knee and wiggle your feet up and down. Good job. Up, up you go, and keep it there. Hold it there. So let me push it down. Good job. Push my hand. Good job. Extend your knee. Don't let me push you down. Flexion. Bend your knee. And now don't let me pull you. Don't let me pull you. Good job. Up. Leg up. Feet up. Don't let me pull you. Good job. And push my hand. Good job. Great. So, do you feel this? Does it feel alright? No problems at all? Do you feel here? No problems at all? No. Alright, does it feel different?
No.
Alright, do you feel different here?
Yeah. Where, outside or?
Yeah, outside.
No.
Inside?
Yeah, just maybe a bit less on this one here.
Alright, what about the back of
Yeah,
your
no,
foot?
it's okay.
Soles? Feels alright?
Oh, no, feel good, feel good.
Feels good. Alright, so close your eyes for me, please. And I will do up and down with your thumb. And you, sorry, not your thumb, your toe. And let me know if it's up or down.
Up. Up. Down. Up.
Great job.
Up. Down. Up. Down.
Beautiful. Keep your eyes closed. Let me know if your knee is straight or bent, alright?
Bend. Straight. Straight. Bend.
Keep your eyes closed. I'm gonna do it really slowly.
Straight. Bend. Straight. Bend.
Beautiful. Sensation and proprioception are working great with you. Open your eyes. Good job. How do you feel?
Good.
You feel alright?
I feel alright.
Beautiful. So, show me how do you stand up from there, please. You usually stand up like that. Alright, now forearms to support you.
Yep.
Alright, have a seat for me, please. Beautiful. I know the knee doesn't bend too much, so try to make as far as you can. And try to scoop you forward for me. Scoop forward, scoop forward, scoop forward. Up, up. Yeah. Alright. So try to push with this knee as well. Alright? It's gonna be painful, I know, but this is something that we need to start working on to get this leg strength.
Okay.
Alright? So let's count to 3. 1, 2, 3, and up you go.
Okay.
Alright. Alright. Are you able to extend your knee?
No.
So that's the further you can go?
Yeah.
Easy. So put your weight on the left, and then the weight on the right. Alright. Beautiful. Now, knee up for me, please. The right one. Alright. Now what about the left one?
Oh.
Try to make it.
Yeah.
Right one. Right.
Alright.
Yeah. And now the left again. Easy. Alright. So, I know now that you are able to do it. So, I want to know, and take the time, how long can you stand with only one leg? Alright? So, keep your right leg up and hold it there. And I'm going to time 1, 2, 3, 4, 5, 6. Let's say 30. Right, good job. The other leg. 1, 2, 3. 1, 2, 3, 4, 5, 6, 7. Alright, 7 seconds. Put your feet together, please. Alright. Good job. Alright. Seems pretty cool. Pretty okay there. Alright, let's go to the plank for me, please, using your forearm crutches, and I'm going to see how are you walking. Alright, go to to the plinth for me, please. Don't fall. So because you have your right knee down, I want you to lie on that side.
What, my head here?
Yeah, head here, please.
Yeah, can I?
You're not using any, sorry. You're not using any brace, so that's all right.
No.
Let me check your left knee first, please. All right. No problems at all. Hip is all right, no problems. Ankle, all right. Cool. So now I'm gonna do the same with this one. No problem with the hip? No? All right. What about now the knee? Is that the further you can go?
Yeah, it's getting really tight, you know, like
For sure.
Yeah.
For sure. So this is the further you can go?
Yeah.
All right. And probably you are having this lack of extension. So let me see. All right. Let me see how is the range of motion here. I'm going to use my goniometer and see there is a probably 15, less 15, minus 15 degrees of knee extension. That means you are. That means your knee is still stiff there. So I just want to make sure your your kneecap is rolling well. So probably there is a lot of inflammation here. I'm
Okay.
seeing
Even
a lot of
after
inflammation.
4 weeks, eh?
Yeah, after 4 weeks. So I would like just to make sure how much. What is the measurement? You know, measurement
Okay.
of the knee above the kneecap. And above the kneecap, and probably there is 2 to 3 centimeters more, which means that there is still inflammation here. And while we are here, I want to let you know that this is something that you can do at home when you are laying down. Put a pillow under your ankle and let the knee fall.
Like gravity.
The gravity acts and helps you to strengthen the knee. All right. And also, if you can have a look here, feel what I'm doing. Try to work on your kneecap, going up and down and side to side. All right. This is something that is going to be really helpful for you in terms of getting back the motion of your knee.
Okay.
All right. So we're getting the kneecap up, down.
You want me to do that, or?
Yeah, you can do that at home.
Ah, okay.
This is one of the things that you can do at home.
Oh, okay.
All right,
Okay.
like part of the self-management.
Oh, okay.
All right, so roll side to side, up and down, and you can also do tilt. All right.
Okay.
So this is the kneecap. It's like a really flat bone that we need it to slide up and down, side to side, and also tilting.
Yeah.
All right. This is tilting, up and down, side to side, and tilting. Make sense?
Okay.
Any question with that?
No.
So this is something that you could do at home during your, when you're resting or whatever.
Okay.
Help your kneecap to start rolling over.
Yeah. Okay.
All right. So now that you're there, I want to know what your level of strength is in your right knee. Sorry, right leg. All right. So can you take your knee up for me? Up.
What, like this?
The right one.
Yeah.
Yep. And hold it there. Don't let me pull you down. Good job. Push my hand. Good job. Now extend your knee for me, please. And then let me push you down. All right. Now, then let me pull you. Good job. Now, toes up for me. Good job. Push my hand. All right. There is a little bit of weakness in this leg, which is something that is really expected. All right. So the first thing that I want you to do is work on the inner quad ranges. All right.
The what?
Inner quad ranges.
Okay.
Inner quad range exercise.
Okay.
All right. So what does it mean? We are going to do this. All right. All right. So because the last few degrees you are not able to pull. Make sense to you? All right, so we are gonna work on this last degrees,
Okay.
the outer degrees.
Yeah, okay.
All right, so 10 times, and try to strengthen the knee. 1, 2, 3, hold 3 seconds, and then release. All right, again, 1, 2, 3, and then release. Again, 1, 2, 3, and then release. 1, 2, 3, and then release. This is one of the exercise, home exercise program. All right, it's gonna be 10 times.
Yeah.
All right.
Okay.
Again. 1, 2, 3, until you count 10. All right.
Oh.
You're gonna do 10 of them.
Oh, okay, okay.
Makes
So
sense?
10 times
Yeah.
for 3 seconds.
Yeah. Sure.
Okay. Number 6.
7.
Number 7. Number 8.
8.
Number 9. Number 10.
Beautiful. So, the second exercise that I want you to do at home is gonna be this one. All right. So, take your knee up for me, please. Up, up, up. This is the further you can go. In flexion. All right. Let me assess how far can you go. This. All right. Let's say 100 degrees. This is the further you can go. All right. So, the first thing that you can do at home is try to get your leg like that, and with your left leg you will help you to bend the knee. All right. Try to roll back and forth.
With this one?
No. With your right leg, try to roll back and forth like so.
Okay.
And then when you are feeling, the pressure here or the stiffness, try with your other leg, the left leg, to pull you a little bit more. To push you a little bit more.
Okay.
Makes sense? 1, 2, 3, and extend, and get back again. 1, 2, 3. You will feel a lot of stiffness here.
Yeah, it's tight.
Like it's really tight here, tightness here.
Yeah,
so
tightness.
Muscles, soft tissue, and the bones has to start sliding again. All right, so that's why you are feeling this stiffness and really tight inside your knee.
All right.
Plus, it is really still really inflamed, still inflamed. So we still have inflammation here. All right. So 10 times, and that's gonna be the second exercise that I want you to do at home.
And then I just push. Okay.
Just push. All
Do
right.
I go? How far do I go?
All right. So let's put things in number from 0 to 10. 0 is not pain at all. 10 is the worst pain that you could ever imagine. Don't go over the 5.
Over 5. Okay.
All right.
Yeah. Okay.
Has to be slightly painful. Pain is gonna be there because we are stretching, the soft tissue there. But yeah, we don't go over a 5 out of 10 because that means we are producing more damage than the benefits.
Okay.
All right. So 10 times. Go with it. All right. Nine and 10. Good job. Now can you sit for me please here? Good job. How are you feeling?
Yeah.
It's all right.
Yeah. Good.
All right. So let's go and have a walk to the chair that I have here. All right. Take your forearm crutches and go to the chair. All right. So have a seat in that chair for me, please. Cool. How are you feeling? How's the pain now?
Yeah, it's
Feels all right?
It's okay.
It's all right.
All right. It's not a 5, it's a 4.
All right. Fair enough. So what are we gonna do now is we are going to do a time up and go. All right? Do you see the 3-meter mark there? The 3-meter here? When I say go, I want you to stand up, take your crutches, walk as fast as you can in a safe pace. I'm gonna be standing next to you just in case. You're gonna get to the 3-meter mark, turn around, get back and have a seat, and I will stop the timer.
Okay.
Make sense?
Okay.
Are you ready?
Yep.
1, 2, 3. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. Good job. How is your pain now?
It's okay.
All right. It took you a while, Gina, to get to the 3-meter and
Yeah, I just
get
had to
back.
find my stride. I think I can
For
do
sure.
better.
Probably yes, you will be able to do it better. It's just that every time that the patient scores over 13.5 seconds, means that the patient or my patient is still at high risk of falling, and that means it is not safe for you to walk without any assistive device, or we have to improve, the overall risk of fall. All right, and that's because obviously your leg is not working as normal as should be, because it's only 4 weeks after the surgery. There is a small weakness on that side, and also the range of motion is not the best. So we are going to work on that, but probably in the future sessions it will improve. And also there is a few gait impairments that we can work on now and make you work walking a bit better.
Okay.
For now, okay? So I already gave you 2 exercises when you were sitting.
Yep.
There is gonna be just 4 exercises to do at home.
Yep.
All right. So the 3rd exercise that I want you to do at home is get as far as you can with your knee, and then with the other leg, you're gonna pull back. Pull back. No. Pull the leg back.
Oh.
Pull back, and you're gonna feel.
It's tight, eh?
Tight. All right. Remember, no
But
go over the 5.
I must. Yeah. Okay.
This is something that is going to be really good in improving your range of motion, your flexion. All right.
Yeah. She's giving me all these exercises.
For sure.
So,
For sure. So remember, this is going to improve your flexion range of motion, and putting one pillow under your ankle will improve your extension range of motion. All right? How far you can extend the knee, because it's also impaired.
Okay. Yeah.
All right? So those 2 things, I want you to keep that in mind.
Okay.
All right?
Yeah.
But at this stage, the most important thing is getting you a nice and better knee flexion.
Okay.
All right? So 10 times with this leg. Let me explain you. You're gonna go as far as you can, then push a little bit. 1, 2, 3, and then release.
Okay.
1, 2, 3, and then release. Again, 1, 2, 3, and then release. 1, 2, 3, and then release. 10 times.
10.
10. Beautiful. Now the last exercise at home that you're gonna do is 10 sit to stands. All right. So hold on to the arm rest, and standing. Get as much straight as you can, and then sit back, sit down. All right. 10 times. I'm gonna sit just very close to you. 1. 2, 3. Wait a minute. Remember, try to keep your knee, your both feet at the same level.
Okay.
All right. All right. Good. And keep in mind to put weight on that leg. All right. I know it's hard.
Yeah.
Probably it's gonna be painful.
Yeah.
But remember, not go over the 5
Right.
out
Okay.
of 10. High 5 is okay. All right. 8, 9, and 10. Good job, Gina. Good job. How are you feeling?
Good.
How is your level of pain now?
No, it's still a 4. It's
Alright.
okay because I'm not standing on it too much, right?
Okay, so if pain comes after the session today, the pain shouldn't last over 24 hours.
Okay.
Alright, it's normal if you have pain after the session. That means we are stretching the tissue, we are working on the muscles, the joints are having, this movement, and that's normal. But we don't want that this pain goes over 24 hours.
Okay.
Alright?
Okay.
If it goes over 24 hours, let me know in the next session so we can take one step back.
Yeah. Okay.
Alright, so stand up for me, take your crutches, and we are going to improve your walking pattern.
Okay.
Sorry. So what I want you to do is, first of all, both crutches goes in front of you. Then you are going to walk with the right and then the left. But the left has to step through. Alright, let me do a quick example. Crutches, right, left. Alright, crutches, right. This is what you are doing. Crutches, right, left, and the left step 2 at the same level of the right.
She
But
showed me this.
Yeah, but this one is way more safe
Too
for
much?
you.
Ah, okay.
This is safer for you. Alright? So crutches, right and left, and the left and the left has to step through.
Okay.
Right? Yep. Makes sense. Beautiful.
Okay.
Go back. Go back. Alright. Beautiful. Now, we are gonna try to work on your heel contact on the right leg. So try to make sure you land on the right,
Okay.
you land on the heel, and then you go back. Land on the right and go back. Alright? And go back. Yeah.
Like this?
Like so. Beautiful. Alright, so let's try to do a nice and high hip flexion. Alright, and then try to exaggerate the knee extension. I know it's hard, you probably are not going to get the full range of motion, but try to get as far as you can with the knee. Alright? Yeah, way much better. And then go back. Beautiful. That way we will be working on your hip flexors, knee extensor, knee flexors, all the leg muscles. Alright? One more time, 10 times. Back. Beautiful. How are you feeling now, Gina?
Good.
Are you
Okay.
feeling okay?
Yep, pain is okay.
Alright. One more time. And you are done. Have a seat for me, please. Good. Now we have learned a few techniques to improve your gait. So I want to retest you on the time up and go.
Okay.
Alright?
Yep.
So basically the same drill. When I say go, stand up, walk as fast as you can in a safe pace, then go. Come back and have a seat.
Okay.
You ready?
Yep.
1, 2, 3, go. 1, 2, 3, 4, 5, 7, 8, 9, 10, 11, 12. Way better, Gina. Way better than before. Much better gait pattern, and the time went much better. So as you said before, was much better this time. All right. So yeah, I'm happy with what we have tried today. I want you to keep in mind the exercises that I gave you. Okay. So let's get back to the plinth and see how your knee respond to the treatment today. Back to the plinth and see. Let me put a pillow to see if there is any slight improvement in your knee extension. So before was minus 15 degrees of knee extension. All right, so I'm not expecting bigger changes, probably 5 degrees. All right, so let's say now it's minus 10. All right, and what about the knee flexion? Did we get any improvement here? So before it was like 100 degrees, and now I'm seeing 110 degrees of knee flexion. All right, so it's just a slight improvement. I'm happy with it. Keep working on that, Gina. So remember, so we can work on the knee extension. I want you to get a pillow under your ankle, your right ankle, and try to push with your knee down and release. Yeah, that is going to give you, you know, the knee extension. All right, and then I'm going to email you the 4 exercise.
Okay.
To do at home.
Okay.
Do you have any questions in regards to the exercises?
When do I see you again?
For sure. Today is Tuesday. I want to see you again on Friday.
Okay.
Is that all right for you?
Yeah, that's
Any
fine.
questions for me?
No.
Okay, cool. Good job.
Good.